Suswagatam, Suswagatam, Suswagatam. Good morning and a warm welcome to all respected delegates and participants from all across the country. I, Dr. Sneha Takle, first year PG scholar, Kayachikitsa department, feels privileged to welcome you all on behalf of Kayachikitsa department of Hon.Shri.Annasaheb Dange, Ayurved Medical College, Ashta, for national webinar on Hridrog Chikitsa, Hridayarnav 2022. In Ayurveda, before starting any function or ritual, we pray to Lord Dhanvantari. So let's do the same by offering prayer to Lord Dhanvantari.
शंखं चक्रं जलौकां दधदमृतघटं चारुदौर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृद्यां शुकपरिविलसन् मौलिमं भोजनेत्रम् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिणम् निखिल गगवना प्रौढनावाग्निलीलम् प्रौढनावाग्निलीलम् प्रौढनावाग्निलीलम्.
With this blissful starting, now I request our organizing secretary of this event, Dr. Parag Deshmukhe sir, Professor and HOD, Kayachikitsa department, to give introduction of this webinar. Over to you, sir.
Good morning all. Myself Dr. Parag Deshmukhe on behalf of Department of Kayachikitsa, Honorable Shri Annasaheb Dange Ayurved Medical College, PG and PhD Research Center, Ashta, Sangli, Maharashtra, accredited by NAC with grade B+. I welcome to all respected dignitaries and participants in this national webinar on Hridrog Chikitsa, Hridayarnav. The word Hridayarnav consists of Hriday and Arnav. It means dealing with the impulse of heart. As we know, cardiovascular disease is the leading cause of mortality among the non-communicable diseases. Considering this, we are trying to focus on clinical approach of Hridrog. So this is our initiative to align modern and Ayurvedic approach towards Hridrog Chikitsa. I express gratitude to our patron, Honorable Shri Annasaheb Dange, Appa, Founder and Chairman, Sant Jnaneshwar Shikshan Sanstha, Islampur. I welcome and thankful our dynamic secretary, Honorable Advocate Rajendraji Dange, whose guidance enabled us to conduct this webinar. I take this opportunity to welcome our advisor, Professor R.A. Kanai sir, who is Executive Director, Sant Jnaneshwar Shikshan Sanstha, Islampur. It is my honor and privilege to welcome our chief guest, Dr. Satish Paranjape sir, most senior and renowned physician from Sangli district. I take this opportunity to welcome Dr. Harish Bhakuni sir from National Institute of Ayurveda, Jaipur, as a resource person. I also welcome Dr. Jai Prakash Singh sir from Varanasi University, Varanasi, as a resource person. I also welcome Dr. M.B.B.S.M.D as a MHS observer from Hridrog Medical College, Mumbai. I express gratitude to our principal, Dr. Ashok sir, for his valuable support and guidance to conduct this webinar. So once again, I welcome all dignitaries and participants in this national webinar on Hridrog Chikitsa Hridayarnav. Thank you. Welcome all.
Thank you, sir, for this commendable introduction, which gave a glimpse and set a perfect platform for this webinar. Now, I request our beloved principal, Dr. Ashok Wali, sir, to deliver a few words about this event. Over to you, sir.
Thank you. Good morning, all the delegates, participants, and the resource person, our chief guest, all the delegates. Sant Dhaneshwar Shikshan Sanstha Islampur, which is situated in the Sangli district of the Maharashtra state. It having around about 44 branches in the various education fields, especially Ayurved, engineering, pharmacy, nursing, ashram shala, public school, international public school. So many education branches are having with this institute. Honorable Annasaheb Dange Ayurved Medical College is one of the branch of this Sant Dhaneshwar Shikshan Sanstha. It started 1999, which is approved by the NCISM and affiliated to the Maharashtra University of Health Sciences, Nashik, with 100 UG capacity, 37 PG, and we are having the 12 seats in the PhD, especially in the clinical subject. We have well-equipped departments, and infrastructure is a very good. We accredited by the NAC with B+, and also we have the ISO certified. We have 244 bedded Dhanvantari hospital, which is situated in Ashta. And this hospital is a very good in premises and having so many departments. Especially the department of the Kayachikitsa is well equipped. We have well recognized staff also there, and we have PG and PhD in Kayachikitsa. Especially we are taking yearly CPR training for the students, and also we have started a Panchabhautik OPD here in our Kayachikitsa department, which is invented by late Datar Shastri. So daily OPD is round about 80 to 100, and IPD is 50 to 60. Because of this COVID, the intake of the IPD and the OPD comes down. But hope in future we will get more patients in our hospital. We have all facilities in our hospital, including the ultrasonography. We have dental, we have eye, ENT, and Pathya department. So many things, especially all the departments we have in our hospital, which is running since 1999. I welcome this seminar as a resource persons, Mr. Harish Bhakuni sir and Dr. J.P. Singh from the BHU. Sir, on behalf of Annasaheb Dange Ayurved Medical College, I welcome you. Maharashtra University Health Sciences, we have taken permission for this webinar, and they allotted as an observer Dr. Minal Vaidya from Mumbai. I also welcome Dr. Minal Vaidya. And today's chief guest, a renowned physician from the Sangli, very senior person, Dr. Satish Paranjape. Sir, I welcome on behalf of my medical college. Once again, I am very thankful to all, and I hope that this Hridayarnav 2022 will give something new dimensions to all delegates. Thank you. Thank you very much.
Thank you, sir. We are very much obliged by your constant guidance and support. Today, we are glad to have some special guests with us. For that, I would request our coordinator of this event, Dr. Sushant Kanse, sir, Assistant Professor, Kayachikitsa Department, ADMC Ashta, to introduce our today's esteemed chief guest, Dr. Satish Paranjape, sir. Over to you, sir.
Very good morning to all. Myself, Dr. Sushant Kanse, Assistant Professor, Department of Kayachikitsa. Chief guest of today's webinar, Dr. Satish Paranjape, sir. It is a great honor and blessing of Lord Shiva. I express my special gratitude to sir. Dr. Paranjape, sir, is a great physician working in medicine field since more than 35 years. Long journey of providing medicine service. Sir is completed M.B.B.S. from Government Medical College, Miraj in 1979. He has completed M.D. Medicine in 1983 and fellowship in critical care in 1994. He started ICU in Sangli, also give facility of non-invasive ventilator and ABG machine first time in Sangli. Sir has treated with thrombolysis more than 3,000 patients of MI and 2,000 patients of poisoning. He is having very huge and successful experience of critical care unit. Such a legendary personality of Dr. Satish Paranjape, sir, is a chief guest of today's webinar. I give warm welcome to Dr. Paranjape, sir. Now I request to sir inaugurate this webinar and guide us.
Yes.
Thank you, Sushant, for your kind words. At the outset, I declare the webinar open for all the students who have joined the webinar. This is a new experience for the generation like me to talk to a screen of a computer than talking to the students. Then you can make an eye-to-eye interaction. You know whether the students are following you or not. You know if somebody is dozing out or what. But now this is, I don't know what is this. Somebody is listening, somebody is not listening, somebody is eating and whatnot. But now here I am forced to sit in a peculiar manner at a peculiar chair and whatnot. So this is a new experience for me. Can I have first slide, please? Okay. This is the place from where I bring the greetings for you all. This is the holy place of Ayurvedic hospital at Ashta. These are our patrons, Honorable Shri.Annasaheb Dange, who is founder and chairman of this institute, and now ably run by his son, Advocate Rajendra Dange, sir. Now is Dr. Wali, who is a principal over here, who is a guide and philosopher, who is always kind enough to guide us and teach us. Let us come to today's topic now. It's now I'm being asked to talk about AMI in younger age group. Okay, so what is AMI? It's myocardial necrosis due to acute coronary occlusion. Usually it is thought that this is the disease of the elder age or older age people, say more than 60 plus. And this is because of the advanced stage of atherosclerosis. That is the culprit. Okay. So this is basically acute on chronic process. Atherosclerosis is going on. There is acute plaque rupture superadded by platelet thrombus, resulting into a occlusion of the vessel. Right. So this is the coronary artery disease is the leading cause of death in Western world. Males also dominate here in death rate. Usual age was about 60 years. I purposely made was as a red because there is some change in the scenario, change in the perspective of the disease. So what is the change? Change is the change in the age group of the patients, right? Okay. So in clinical practice, we see this disease at much younger age group, say maybe earlier than 45. So out of total infarcts, more than around 25% of the infarcts come from below age of 40 years. And so now projection is around 62 million Indians will have CAD because we are the pioneers, or rather we are the greatest number of diabetics in India, of which the now number is expected to increase to around 30 to 35% of AMI, which will come at the age of rather less than 40 years. So this was the stage. On left side, you can see the son bringing his father to the ICU or to the CCU for his ailment. But for after around 2000, the perspective has changed. Father used to bring his son for his complaint of chest pain. It was very difficult in the practice to accept this change. It's very easy to talk to somebody or the relatives that his 80-year-old person is suffering from infarct. Naturally, everybody knows that heart attack is a disease of elderly. But talking to an old person that his son is suffering from heart attack is quite painful, quite, what shall I say, patients find it very difficult to believe. And they used to say that your machine could not be right working in stage. So you change the machine or change the expert or call on some expert for the diagnosis confirmation. So this was the change in the scenario, right? So this is that great virtuous triad where the endothelial, there is 3 angles of the triad where endothelial dysfunction, stasis and hypercoagulability were the 3 corners. In older age group, that endothelial dysfunction and stasis of the blood flow are the mainstay of the problem. So let us see. So in backbone of the Indian health is in urban area, civil surgeon is the chief of the unit. In rural area, it is a DHO who holds the responsibility of the Indian health of the Indian people. in rural areas. So by CS, I mean coronary artery disease and stress and smoking. By DHO, I mean diabetic dyslipidemia, hypertension, obesity. These were the causes we were blaming for the people of elder age group who used to come to us for infarcts. Now the list has gone in multiple way, or it has increased exponentially. I made a couple of sentences very bold, like smoking and sedentary lifestyle, hypercoagulable state, hyperhomocystinemia, poor consumption of fruits and vegetable in our diet. And last one is not last but not the least is workaholic patients or workaholic persons. Okay, so there are some changes in the presentation or etiology. Just a minute. Okay. I will stress smoking for n number of times during these 10 more minutes, because this is still holding the fort. I should not call it as a fort, but the culprit of the disease, right? People who are not allowed to smoke, they go mad like this monkey, right? And now this is workaholics. I see many patients in prior practice who primarily come from the IT department at the age group of 30, 35 plus, recently married, freshly detected diabetics. And they go to my gynecology colleagues also for their personal problems like primary sterility. So now on the left side, you can see a young patient with lot of stress. And on the right side, the person who is in charge of the units lying down on the table. We have seen doctors lying down in the ICU also, I mean, taking rest on the ground. So this is quite stressful situations we are going. We are impressed upon by the salary they get, say something like 30 lakhs per year, 40 lakhs per year. But we don't know how much they are burning themselves out, right? So on left side, you can see the couple working for their offices, maybe in the same office, maybe different office, but the timings are different. On left side, you can see the girl working for San Francisco and New York. They say that jug saath mein aa gaya hai. And the right person who is working for the Mumbai or other person, the company gives them a dream that they are going to have their vacation maybe at Switzerland. But I don't know whether do they get the vacation to go there. And their primary problem is primary sterility. And they don't know. Looking at the computers, they are not going to have their kids. And they are quite stressed. So let us see. And this is the situation, working from home. We really feel that working from must have given them a comfort. But now they say we start our job at 8 o'clock, but we don't know when we have to stop it. It goes up to 2 o'clock in the morning. They just cannot go to pee or poo even without computer. I don't know whether there is some remote program going on fed to their laptops. And that results into a metabolic syndrome, which results into central obesity, and which brings all these diseases like type 2 diabetes, insulin resistance, myocardial problems, and a number of things. Right? So now coming to the young adults. So young adults' problem is the coronaries are normal, basically normal, primarily are not blamed at. So if the coronaries are normal, we find it very difficult to understand what could be the pathophysiology of the patient suffering from CAD. Okay, So there is different pattern of dyslipidemia, whether TC is normal, low HDL and high LDL to TG ratio. And what is coming up very fast is insulin resistance, right? So this makes the Indians more vulnerable at the younger age group. And all the time till this date, we are blaming atherosclerosis as the reason or the only reason. Possibly we are barking at the wrong tree, labeling CRP and little LPA or homocysteine or HbA1c and whatnot. So now this is the change in the clinical practice. On the right side, you can see the person without gray hairs, without bald hair, coming with the chest pain. And in earlier practice, we used to call them as neurotics. But now I find it very difficult to call them neurotics or label them neurotics before we investigate, right? So it's very difficult to prove that, and now we have to make an effort to prove that there is nothing wrong in their coronaries. So now let us see what are the similarities or what are the differences. On left side, you can see the actor who is making a show or playing a show in a movie. And on right side, we are trying to find out the difference in the cartoons, right? So let us try and find out what are the similarities and what are the differences between young patient and older patients, right? Okay, so clinically, it's more, things are quite similar, that you diagnose by ECG, confirm it by the enzymes, and then the confirmed again it by the echocardiogram showing the hypokinesia, akinesia, LV thrombus, and whatnot. But still, angiogram, coronary angiogram is still a gold standard, which shows a acute block, maybe a single vessel or maybe a multiple vessel. If it is a single small block, we start treatment. Rather, it could be we start treatment in the ICU by aspirin 350 milligram stat. It is said that it is as good as thrombolysis. Then you will use most of the antiplatelet drugs like clopidogrel and statin. And there was a big, about 5 to 10 years back, there was a big coming in the market was something like polypill, which used to have a single pill containing aspirin, clopidogrel, statin, metoprolol, maybe ACE inhibitors, maybe an anxiolytic, and maybe a Dulcolax, a tablet of Dulcolax also. So that was the concept of polypill. Okay. So after giving the initial oral treatment in the ICU, we treat them by thrombolysis. The treatment is still the same for the younger patient or the elder patient. We thrombolyze either by streptokinase, urokinase, or tinactiplase, whatever is available, whatever is cheaper, whatever is acceptable to the patient. After thrombolysis, usually we have been trained to go for angiography and confirm the vessel is open or not. On left side, you can see the vessel which is blocked, and on right side, you see the plasty being done and the vessel being open, which shows a good flow. So concept is you have to have open vessel, right? Okay. If there are multiple blocks on coronary angiogram, we pose the patient for thallium scan, prove that the myocardium is viable, and then pose the patient for ABG. The primary, after the patient is treated successfully, comes out of ICU, possibly we have to concentrate on the obesity, secondary prevention, right? So we have to talk to the newer generation, the importance of exercise. On left side, you see the Carl Lewis, in my age group, or when I was young, he was the fastest person who ran the Olympics in world record time. So walking for at least 25, brisk walking, for at least for the 25 minutes per day. What they say, they have found out that almost your life expectancy increases by 7 years. That's a good achievement or good gain you get just by walking. And walking does not cost you anything. You can walk in a garden if at all they are still available near your place. right? And now let us find out some differences between younger infarcts and older infarcts. I was quite amazed. I spent a couple of minutes while searching on this cartoon itself. What are the 5 changes on left and right? So it was quite interesting. That is possibly a stress relieving. So what are the changes? What are the differences between young infarcts and older infarcts? It is the normal coronaries in the younger patients. And then what you are blaming for is thrombosis because of hypercoagulability, inflammation, embolism, vasospasm, maybe a minimal concealed atherosclerosis. In the elder age group, we blame atherosclerosis as a first problem, right? So now the problem is different. The solution has to be different also. So in AMI, in the younger patient, we have 4 categories: atheromatous IHD, non-atheromatous IHD, hypercoagulable state, and substance misuse. Okay. So in atheromatous IHD, I will still stress smoking as a first culprit or first risk factor, and then comes the obesity, insulin resistance, what was we had seen in atheromatous disease, and now newer coming is the hyperhomocystinemia, right? I just talked to my students here about the hyperhomocystinemia when we talk about the methyl folate trap. When the B12 is absent, B12 is non-available, homocysteine cannot be converted into methionine, and homocysteine keeps on piling, methionine is not available. And this piled up homocysteine causes endothelial injury, causes vasoconstriction, and causes it is thrombogenic, right? Okay. Coming to the next, abnormal coronary arteries. Now the coronary arteries is commonly seen, what we see in younger patient is myocardial bridging, coronary artery dissection or aneurysm, vegetations, and then we see the embolization also, maybe from aortic valve, drug misuse, bacterial vegetations, or maybe paradoxical embolization, right to left in a patient of patent foramen ovale. This is myocardial bridging. When the coronaries are epicardial vessels, sometimes they enter into the portion of a myocardium, and when the heart contracts in systole, they compress the vessel, and you can see on the right side the coronary is being compressed during systole, and on the left side you can see the diastole, the coronaries are open, so they are temporarily compressed, but during each cardiac cycle they are being compressed frequently, and then patient presents as angina. Okay, or there could be a coronary artery tear or dissection. You can see here the tear is initial stage, which get expanded, blood enters into the shears down into the vessel wall, and you get a thrombus resulting into a coronary block, right? Now I just change the sequence. I take out the substance misuse first before I talk to hypercoagulable state. Substance misuse, cocaine misuse was first found when the young patients were getting admitted during the festival season in December in states, and they were blamed to have misuse of cocaine, and cocaine does cause tachyarrhythmias in spite of absence of MI. So VTAC is more common in these cocaine misusers. There is possibility of cardiomyopathy and endocarditis. This smoking of these mood elevators like marijuana or amphetamine again is blamed, and binge drinking of alcohol, right? We have seen beer potomania is causing one of the electrolyte imbalance, and again that is the culprit. Now we are coming to the main player of the problem is hypercoagulable state. So what is that? There are a couple of things which I have mentioned: antiphospholipid antibody syndrome, factor V Leiden reduced, antithrombin 3, oral contraceptives, and nephrotic syndromes, to name the few. So So before I go into the further details of this, I take this opportunity to talk to you about what is the coagulation cascade going on, so that you can understand all these disease process or hypercoagulable state. So again, this is famous, that virtuous triad. But now we are trying to concentrate more on this hypercoagulable state rather than endothelial dysfunction, right? Okay. So in these patients, the coagulation cascade is what shall I say, is disturbed. Either activators of coagulation and inhibitors coagulation, their control is gone, and their balance is gone. So it deviates on the other side or one of the sides. So there is irrational coagulation stimulation resulting into coagulation problems, and coagulation is going on in overdrive, faster speed. So this is the famous what shall I say, cascade, showing many figures, many arrows going to the right, going to the left. Some are green, some are red, and all confusing. So I try to make it simplified. But this is that simplest version of that cascade, intrinsic and extrinsic pathways. But I still make it still more convenient or comfortable or easier by just making this red. You can just look at the red square where the factor 5A or activated factor 5A, activated factor 10A, in presence of calcium and phospholipids provided by the platelets, is the mainstay. It is a common major pathway. It's like a junction for these intrinsic and extrinsic pathways. And the situation is that if somebody gets a thrombus, it does not happen that patient is getting that thrombosis process keeps on continuing throughout the disease process, then it automatically stops. So there are some natural mechanism to stop this thrombotic process, right? So there are some processes which stop it, some processes which stimulate it. Okay, right. So now the protein C and protein S, and there are multiple, they suppress the factor 5 and factor 8. This is the factor 5 here, and it suppresses factor 8 as well. Then antithrombin 3 is a natural suppressor which suppresses thrombin and factor 10. So if this is stimulated, or if these are the factors which prevent the hypercoagulation. Okay, so if they are absent, that will stimulate the hypercoagulation. Simple, right? So stimulation of coagulation cascade is because of this loss of inhibition of factor 5, loss of inhibition of factor 10, or loss of inhibition of thrombin, or there could be mutation in the factor 5, what we can call it as a factor 5 leaden. Because of this mutation, factor 5 does not listen to the, or does not allow, or does not agree to the inhibition process by the protein C or protein S. Even though protein C and protein S are normal, this abnormal factor 5 doesn't respond to them and stimulates or continues the thrombotic process. Similar is the case where the prothrombin is now mutated. So that will stimulate the thrombin formation and will start the cascade running faster. Right? If there is abnormal elevated levels of factor 8, that will again end up in stimulating this cascade. And now the phospholipids also don't stay behind. There is a disease called as autoantibodies against these phospholipids, ALPA syndrome, where these phospholipids are, this is an autoimmune disease where the disease process is again faster. So let us go. Few of the cases, protein C or protein S deficiency, as I talked to you, it is and with the help of thrombomodulin, it suppresses, naturally suppresses the factor 5 and 8. If this suppression is gone, that will stimulate the coagulation process. So this is protein C and protein S deficiency. Protein S is cofactor to the protein C activity. Protein C is stimulated or formed by the liver. Okay. So factor 5 laden, what I said is mutation of factor 5 It raises the inhibition of protein C and S. It is practically one of the same way, and that stimulates the cascade. Now this is again a prothrombin 2021. I don't know what is that 2021, but this is again a mutation of prothrombin. That hyperactivity of this mutated prothrombin result into stimulation of this coagulation cascade. So that results into a hypercoagulable state and infarctions in younger patients. Next is antithrombin 3 deficiency. What I said was thrombin 3 is a natural anticoagulant which naturally it inhibits the factor thrombin and also it inhibits the factor 10. If that is absent, the cascade will start running faster. And this is an antiphospholipid antibody syndrome, APLA syndrome. These patients go to the gynec department because of repeated abortions, natural abortions, or loss of babies. Because ultimately it ends into a thrombogenic state, which causes thrombosis in the placental circulation and causes loss of baby or fetal loss. So these are the few hypercoagulable states. How to remember all these things? It's something like calm apes. I don't think apes are calm, but this is calm apes. Just to remember the names, complete the list. And now this is calm H ape. H is silent, right? So these are the things: protein C deficiency from calm, antiphospholipid antibody syndrome, factor V laden. Few of the malignancies, particularly acute myeloid leukemias, they present like they present like thrombotic events. Hyperhomocystinemia or heparin-induced thrombocytopenia is responsible for this H. Antithrombin 3 deficiency, prothrombin G2021OA or paroxysmal nocturnal hemoglobinuria, elevated factor VIII, and protein S deficiency that practically works through protein C deficiency only, and the sticky platelet syndrome. These are few factors which are responsible for the infarcts in younger age group. These diseases are not diagnosed very easily. First, we have to treat the patient, salvage the patient, treat him successfully, and then try and find out the cause if one of these factors are available. So in clinical presentation, what is the difference of this presentation in younger age group? The patients present as a full-blown picture right at the first instance itself. They don't come as a unstable angina or crescendo angina. Their duration of symptoms is very short. So these patients have higher morbidity and mortality because the collateral vessels are not developed. So there is acute blockage of the coronary. So great psychological impact on the family members. Find it difficult for doctors to express the seriousness because of great financial constraints for the families, because the main earning member is down on the bed. And then your job in the ICU or CCU is to be alert. You cannot doze down in ICU. No way, right? So be alert in ICU. This is my request to all the students in ICU, working in the ICU. I know that it's very taxing, but you can cut down the time period, but be alert in ICU. You should look at the patient as your parents or some of your parents who is being admitted, and then you will be alert and will not doze like that. Okay. So this was another history you should look for. Recreational drug use. This was quite common in states in December in festive season when the cocaine use was quite high, and they find this use of cocaine as a culprit for this acute infarcts in younger age group. So the management is same. You collect the samples, look for blood sugars, lipids, look for cardiac markers, diagnose it by ECG, STEMI, non-STEMI, echo, confirm it by echo, look for the, and now would you treat for, look for the hemodynamic stability is the major concern or major problem. There is always a sympathetic hyperactivity, tachycardia and diaphoresis, and you are tempted to use beta blockers. But wait, for these younger patients, beta blocker to be started a bit late. Look for this dyslipidemia signs, and treatment is same like MONA. Morphine, oxygen, nitrates, aspirin, beta blockers you hold on for a while. To thrombolyze, present the patient for coronary angiography, either go for plasty or bypass to say that it is open, or to look for the open vessel disease. So antiplatelet like same, right? But the difference is you start the treatment for homocystinuria or homocystinemia, vitamin B12 or vitamin B complex, ACE inhibitors to be used for prevention of cardiac remodeling, beta blockers at a later age, and now use of oral anticoagulants maybe for the lifetime. And they have to explain them the drug regularly to be taken on. I cannot prevent myself for rather repeating stop smoking, and weight reduction. So weight reduction, this was the common eating habits in states: a big glass of Coke and pizza and a cake and potato chips with sauce. That was the main food, and we had enjoyed that when you were on a trip to USA. But for a day or two, you find it's okay. But then again, you go back to your roti, bhakri, bhat, and whatnot. It was not happening there. Now this is stop smoking. This is my urge. But now I'm really happy that newer generation is much wiser. In my college days, there was smoking was quite in a higher number, and now the smoking is practically in younger generation is less. All over the world, smoking zones different are being made. Now they make the people to go in a different room for smoking, and then they feel shy going to the room. I don't know whether they feel shy or not. They go to the smoking room, smoke, and come back. That will prevent the hazard to the society. Okay. And now this man, Ramdev Baba, has made a what shall I say, revolution in Indian public, Indian people. People get up at 5:30 in the morning, open the videos or open the TV screens. Look, this man doing exercise at 5:30. We are wearing the sweaters and canopies and whatnot in a chilly weather, and this man is on the stage without any preventive clothes for the cold, and he is doing all these asanas and whatnot. He is not a what shall I say, hero of the in the sense of what shall I say, in a hero like Raj Kapoor or Devanand, cinema hero. He has facial paralysis. He is not nicely shaved. His language is very rough, but he is a popular personality. Because of this, he has changed the lifestyle of lot many Indians, right? So now with his help, we are trying to fight this disease of obesity, diabetic dyslipidemia, and CAD in younger patients. I know that, see the disparity between the two wrestlers, but still I hope we are going to win the battle. Thank you very much for your patient listening. Thank you very much.
Thank you, sir. We feel immense gratitude to have you here today. Rising acute MI in young people itself is a concerning topic. Thank you for briefly explaining it. You've always been a blessing in disguise and always will be irreplaceable for us. Now I request all the participants that if they have any doubts, please ask. You can write it in the chat box also. I guess there are no doubts. Thank you, sir. Proceeding further, I would like to invite the coordinator of this organizing committee, Dr. Smita Lokhande ma'am, Associate Professor of Kayachikitsa Department, to introduce our first session guest speaker, Dr. Harish Bhakuni sir. Over to you, ma'am.
Thank you, Sneha. Good morning, all. I extend warm welcome to all at Hridayrog 2022. I find immense pleasure to introduce our speaker, Honorable Dr. Harish Bhakuni, sir. Now I am introducing his biodata. Sir, working as an associate professor at Department of Kayachikitsa at National Institute of Ayurveda, Jaipur, Rajasthan. He guided 9 PG scholars and co-guided 22 PG scholars. He published 28 research articles in various index journals and peer-reviewed journals. He presented 45 papers in various international and national seminars. He delivered 25 lectures as a guest speaker in various workshops and CME. He visited Malaysia and Thailand in conferences as a subject expert. He delivered guest lecture as Ayurveda expert in Cambodia, organized by Ministry of External Affairs, India. He is a member of various committees and examination panels of various universities. He is a member of editorial board in 4 journals. He also took part at 10 TV talk shows as Ayurveda expert. So after his brief introduction of our speaker, I would like to request Dr. Harish Bhakuni sir to deliver his speech on topic clinical approach of Hridrog Chikitsa in Ayurveda. Thank you, sir.
Thank you very much. And first of all, I want to thank all the organizers for giving me this opportunity to share my views on this particular topic that has been allotted to me. I will share my screen first. Just a minute. I think, is it visible now?
Yes, sir.
Visible?
Yes, yes.
Okay. Thank you very much. As you know, I have in the earlier lecture, you have heard about all the things regarding the contemporary sciences and the specialty and the emergency management they are doing at their best. Now I will talk about the clinical approach of the Hridrog Chikitsa in terms of the Ayurvedic principles. So before starting this particular thing, I just want to have some introductory remarks regarding Hridrog. As you know, it is the mool of Pranava Slotas along with Rasva Slotas. So many of the conditions that you witness in the Hridrog is basically the manifestation may be also encountered as a Pranava Slota Dushti Lakshana along with other features. One important thing, as we are saying, it is in Rasas Vikar.
Hello, sorry for interrupting, sir. Please make a full screen. Slide show.
Okay, sorry, just a minute. Yes. Is it okay now?
It's not running, sir. Please make a full screen.
Is it okay?
No, not now.
Is it visible?
Yes, sir. Now,
Yes, sir. Now it is visible.
So, considering this particular thing, two important concepts that I want to talk about. One is the concept that is given in the Hridrog Chikitsa, and the second one is Chikitsa, in which the Hridayrog has been mentioned in Ayurved. The first concept that I am talking about is the Grahini, in which you see there is a derangement of Agni and ultimately the formation of arm. And as the seat of the disease in Urdhva Amashe, so cough with are the main culprit doshas, which are basically responsible for the generation of arm and ultimately producing many of the diseases. As wherever is the pathology is, the dose will stagnate and ultimately they will produce the disease. So this is the concept that we'll talk about regarding the Sandarpanotha Vyadhi. As you see, the sedentary lifestyle and many other factors are responsible for the generation of Hridayrog. So seeing the etiology of the disease, seeing the lifestyle of the patient, the food and the lifestyle that the patient is following, that also gives a clue how to proceed regarding the treatment of the disease. The second concept that comes in the Trimarmi chapter, and before going on the management or the treatment of the Hridayrog, Charak has elaborately described the concept of Udavrat and Ana. So if you see, these two of the diseases are Pakvashayut and basically are symbolic of the Abdarpanotha Vikar, and many of the diseases that we are encountering nowadays, especially in terms of the Hridayrog, are also with the etiology of the Abdarpanotha Vikar. So all these two type of the patient with the various kind of hetus you will encounter in your day-to-day practice, and ultimately by seeing the Nidan, as you know, Hetu Linga Ashta, these are three sutra of the Ayurveda. So you also have a very good knowledge of the Hetu. So Hetu Gyan can be taken up in the concept of the Grahini and also in the concept of Trimarmi, especially if I'm talking about the Udavara. Now, these are some important things that we have to keep in our mind while treating any patient of the Hridayrog. First, it is in Marm. As you know, Trimarmi Adhyay. So, Trimarmi is one of the important thing, and any of the disease which is involving the Trimarmi is quite fatal. And there is lots of mortality and morbidity associated with this. So, while treating any of the disease which is involving the Marm should be taken very seriously and it may have fatal consequences. So this concept is very important while treating the diseases of Hridayrog. Now the second one, the Hriday is the Srotomul of Pranavaha and Rasvaha Srotas. As you know, many of the conditions in which you see the patient of Hridayrog having the presentation of the Pranavaha Srototushti also. So that depends upon the disease condition. Many of the conditions in which the patient is primarily having any sort of the respiratory disease and ultimately it land down as a complication in Hridayrog. Same vice versa, if a patient is having Hridayrog, he may present in the Pranavaya Srototushti also. Because the mool of both the Srotas, like Pranavaya and Rasvaya, the Srotomul is Hriday. So that also we keep in mind while treating a patient. As you all know, the Hriday is the Adhishtan of the Chetana and Adhishtan of the Ojas, especially. So, Oj is one of the essence of our body. So, especially for Oj, if it is lost, then the life is lost, as been mentioned in the Ayurvedic text. So, that also be kept in mind while treating the patient. By all the treatment principle, it is plays a very important role while addressing any of the disease of the Hriday. It is a site of Vyanavayu, Sadhak Pitta and Avlambak Kapha. So all the conductive phenomena that has been taking place through the heart is because of the Vyanavayu, Chetana, and sort of Adhishtan that has been basically governed by the Pitta, and the Avlambak Kapha that basically models the whole heart and it gives and compactness and other various anabolic activities that has been basically governed by the Hriday. Hriday is a rasaj vikar, as I'm saying, many of the condition in which there is rasadushti, and if you see this pathogenesis also, we'll go on detail on that part also. So that plays a very important role. Initially, there is rasadushti, and ultimately, because of that samras, the Hridayrog is basically because of that. And one important thing that I am also talked about, that is the concept of Udavrat. As you know, Udavrat is in Pakvashyottha Vikar, and there are plenty of the Udavrat Prabhutajanya Vikar that has been mentioned in the Udavrat. And also, many of the patients who are coming with the complaint of any sort of the Hridayrog has an heaviness or tightness in chest, along with pain in chest. So these are the features which are basically mentioned at the stump in Ana, which is very important. And this particular thing plays a very important while treating a patient of the Hridayrog. As you know, any sort of pain or any sort of thing that is happening in the Hridayrog is because of the Vayu, and ultimately this is the Vayu that has to be channelized. Means the Anuloman Karma is very important. That's why the concept of Udavrat that has been mentioned in Trimarmi Adhyay of Kayachikitsa is very vital while treating the patient of Hridayrog. So these points should be kept in mind while treating the condition of Hridayrog. So I will give some of the basic concept that has been mentioned in our text, like what are the nidan, what are the hetus. Vyayam, Tikshna, Ati Virek, Vasti, Chinta, Bhay, Tras, Gadati, Chara, Chharda, Am, Sandharan, Karshnani, Hridik, Prani, Tata, Vikata. Now see, these are very widespread nidan. Vyayam, Tikshna, Ati Virek, Vasti means excessive indulgence of Vyayam. Now you can see many of the patients that we are witnessing earlier. Sir was also talking about the episodes of myocardial infarction in young individual. So stress is one of the important factor, but sometimes that we are witnessing the patient is indulged in the excessive physical activity. It should be an like in Ayurved, it has been mentioned samyak lakshana of samyak vyayam. Now, if it is more of the Vyayam, then you know there will be vitiation of Vata dosh. So that should also be kept in mind while the patient, if patient, there will be there will be aggravation of a Vata. So in cases where there is excessive indulgence, excessive physical activity, excessive Panchakarma, or there is Atiyog of the Panchakarma, that can also takes place. And that can land to the Hridayrog. And basically, this pathology or this sort of nidan are basically signifying the condition that we are talking about, that in Trimarmi Adhyay, Udavrat Prakarana, in which there will pratilom gati of Vayu, and ultimately because of this, there is debilitating condition, and ultimately that can produce Hridayrog. But that will be of Aptarpanotta pathology. Chard Am Sandharan Kashnani Hritkirtani Tatha Vigata. Now, one important thing, that is formation of Vek, Sandharan, Vasti, Chinta. These are other things like Chinta, Bhay, Tras, Gadati, Chara. These are the factors. Basically, I'm talking about the mental attributes. So stress and stress related things are very important. And as you all know, the person which have been sympathetically dominant are more, or workaholic, that has been basically mentioned by the sir also. They aggravate Vayu dosh along with Pitta dosh, and ultimately this particular Manas bhav of the disease are also plays very important role. And as we all know, the Chetana Adhishtan that has been mentioned categorically in the Ayurveda is Hriday. So these are the factors, basically the mental attributes or the stress that can land down to the Hridayrog. One important thing, that arm. Now, as you know, Jatrana Dorvalya Sade Sangeto Amu Sagudosh Pukopaka. There will be derangement of Agni first, and ultimately, if the Agni is not functioning properly, so Annamna Pachate Lagvak, it will not digest even the lighter food. This is the stage one, followed by Apakvam Shuktatvam. If it not digested properly, it will land down to Shuktatvam, that is formation, and Ghoram Annavisham Chatat, that is Amavish, formation of the Amavish. and followed by when the arm is amenita samprakta sameni pudishyate, means if this arm afflict with this ras, then it will form the sam cuff, sam ras. And ultimately, if I am talking about anything that will occlude any of the vessels or that can be an sam cuff, which has the property of the patchily, which basically which sticks or which adheres in the srotas, and ultimately that will obstruct the channel, which is called srotosan. And once there is srotosan, that will land down to the vimaraka gaman of the vayu, and ultimately because of which the Thana Shanshay of the Vyadhi will be on this, should be asked to the patient and should be taken properly to the patient, and ultimately then only you can treat the patient. Now coming to the Samprapti, which is very important, because as we are treating any sort of the disease, Samprapti Vighatan is one of the important thing that any of the treatment that we are planning. Dushitva rasa dosha viguna hridagata hridibadha prabhuvanti hridarogam tam prashakshati. Now you can see it is basically Dushitva rasa dosha. Means the dosh, that is sam dosha, basically afflicting with the ras and ultimately producing sam ras. As you know, rasvahi dhamniya, these are circulating through the blood and rust to whole or rakta and rust to the body, and ultimately if there is sam ras, it will affect in the dosha samurchana ves yat khavagunim tatra vyadhi upjayate, there will be khavagunim in there, and ultimately it will adhere there, and ultimately because of which it will create srotorod, and because of which there is viguna gati of the vayu, and ultimately that will hridabadha prabhuvanti, means the normal functioning of the hriday. It can be anatomical, it can be physiological, but as far as if I am talking about the prospect of the Kayachikitsa, I am talking about the physiological stagnation, and ultimately that will produce the Hridayrog. If I am talking about Hridayrog here, I am basically talking about various of the condition of the coronary artery disease. Now you can see the clinical manifestation of the disease. Vaivarnyam Musha Vikas Hikka Swas Asya Vairasya Prasad Chhardi Kafut Kleshu Ruchishya Hridayrog Vividhasthananmi Charak Chikitsa Adhyay 26 Trimarmi Adhyay. Now you can see Vaivarnyam, discoloration. As you know, there is the site of the sadhak. So these sort of diaphoresis and sort of things can produce into Vaivarnyam. Murcha, as there is the Adhisthana of the Chetana. Now you can then only this particular manifestation is there. And Hikka, Swas, Asi, Vairasya, Prasha, Pramoha. Moha and Murcha. Those are basically suggesting that there is the Chetana Adhisthana, and these sort of the manifestation is because of this. As there is, Hriday is also the mool of Pranava Srotas. Now you can see the features like Das, Hikka, Swas, Asi, Vairasya, Chhardi, Kafut, Klesh, Arujo. Now you can see many of the patients who are presenting with this, they have complaint of nausea and anorexia and sort of. So these are the manifestations that has been, you can see in the cases of the patient who are presenting with coronary artery disease or have these sort of manifestation. And in today's perspective, many of the manifestations you can witness in your patient nowadays also. So these are the various clinical manifestation that has been mentioned in our text. Now, these are the 5 variants of the Hridayrog. I will not go in detail. You know about this: Vatik, Vatik, Kaphas, Dosha, and Krimicha. Now, if I talk about the manifestation, if you see the Vatik Hridayrog, there are many of the manifestations had been mentioned in Brihatrayi. Shunya Bhav Shesh Shosh Veda Stambha Samoha Paunadvishita Hriday Shunyata Hridadrav Shosh Ved Stambha Samoha निर्मथ्यते वीर्यते स्फोटिते पाठ्यते अपि च ये सुश्रुत का है वेपतु वेष्टन जीर्णे चात्य अर्थ वेदना चरक ने बताया. Now you can see basically all the conditions that you are witnessing here are basically pain predominant condition, pouring pain, tearing pain, and sort of pain. And one of the important things that I have also told about Anna, stomach. Means many of the patient will complain with the tightness of the chest. These sort of the manifestation that has been mentioned in Vatik Hridrog. Basically, pain is one symptom along with the common symptom of the disease. These are the symptoms because of the Vishishta Samprapti of the disease. Now in Pitta Hridrog, you can see Domayan, Tah, Moh, Santap, Jwar, Pita Bhava. Basically, what happens? Patient is complaining with this clinical manifestation, common clinical manifestation of the Hridrog, and Vishishta Lakshana like this, then only the patient will be categorized as Pitta Hridrog. Now coming to Kapha Hridrog, Staptam Guru Syat Stimitam Cha Marma Kafat Prasik Jwar Kas Tandra. Now, as you know, these are the feature of the cup predominant condition, or though the Hridrog are doshas in nature as it is the Marmadashtan Vyadhi. But if the features of the cuff are more predominant, you will see these manifestations. There will be tightness of the chest, something heaviness in the chest that you commonly encounter in cases of the angina and all. So these of the manifestation are basically in the Kapha Hridrog. And in Sannipata, Vidyas Trilogam, Kapi Sarvalingam, the mixed feature of all the manifestation of the disease are there. Now coming to the Krimi Hridrog, Tridoshe Hridroge Duratma Nishevi. If a patient who is having Tridoshe Hridrog and who till Chiradini means he is not following the diet and dietetics, ultimately that patient will land down into Krimi Hridrog. Now these are the various features. Tivrarthi Uttam Krimijam Sakandum, Tivra Tod Kandus Maharuja Tudyamanam Chavitam Suchi Viru Mandite. Now, one important change, Hridam Twaritam Jayet, Charak has been mentioned. This is a very fatal situation. It should be taken very seriously and should be taken prime attention when we are treating a case of Krimi Hridrog. Now I'll talk about what I feel. Actually, the Hridrog that has been mentioned are more similar to the ischemic heart disease that we are witnessing nowadays. Why I am saying so? Because the pain sort of manifestation are more, and ultimately in Vatik, Vatic, Kapha and other variant of the Hridrog, the pain is one of the more pronounced symptoms. That's why it has to be taken as ischemic heart disease. The description of ISD in Ayurveda is in the entirety of Hridrog as per my view. The features and pathogenesis of Hridrog is similar to ISD at Dushyatu Rasadosha Viguna Hatikate Hridu Badha Prakurvanti Hridrogam Prichakshate. And the features of the Vatic, Vatic, Kaphas and other variant of the Hridrog in which the pain sort of symptoms are more. That's why it should be taken as ischemic heart disease. Heart is a vital organ, thus the disease affecting heart is fatal in nature as it is the Marmadishtan. It is Trimarm. So any of the condition that is involving the Trimarm has fatal consequences. So in that scenario, it has to be taken as ischemic heart disease. Now, as I already told about the pathogenesis, there is occlusion of the channel of circulation to the heart by the cuff and Pitta doshan affecting the ras. The occlusion vitiate Vat dose resulting in severe pain in the chest as there is a pratilom gati of the vayu. Means there will be formation of the samaras and ultimately that will affect the normal circulation or the sputo Sangha and ultimately because of which there will be Vimargaman of the vayu and ultimately when vayu is vitiated it will produce pain. Vatadrate nasti ruja that you know. The main affected channel are Pranavaha and Rasvahisputas and the manifestation of the disease are quite more explain this particular thing because in many of the situation in the earlier part there is pain along with breathlessness, dyspnea and also manifestation. And if I am talking about the Rasvahisputas, there will be many of the circulatory imbalance that has been taking place is also because of the affliction of the Rasvahisputas, like diaphoresis and nausea and all sort of manifestation that reflects the involvement of Rasvahisputas, Ashta and Alasya, Aruchi. These sort of manifestation are the features of the Rasvahisputas. By seeing the manifestation, you can understand that These are the primarily involved scrotus. Though as it is in trimmer, there is other impact in the body also. But majorly, if I'm talking about Hridayrog, the pranavaya and rasvaya scrotus has to be taken care very seriously. The term Dhamini Pratichaya is nothing but atherosclerosis. As you know, in Kapha Nalatmak Vikar, Dhamini Pratichaya is one of the entity that has been mentioned in our text. So, Dhamini Pratichaya means deposition of the atherosclerotic plaque in the intima. So, Dhamini Pratichaya is nothing but the atherosclerosis. As you know, it is in Kaphaj Vikar, and any of the thing that can adhere in the channel is because of the Guru or Guru quality of the cuff. But especially if I'm talking about here, it is the Sam cuff, which has a property. The Ram cuff has slushal property and Sam cuff has patchil good, which has a tendency to adhere into the channel. They will stick into the channel and ultimately they will produce the atherosclerosis, or you may say sclerosis, and ultimately that will produce the disease. The Bada is the normal functioning or the normal functioning of the heart will be involved in that particular scenario. Now, coming to the treatment principle, which is very important, as I told you in the Nidan, in the Lakshan of the disease. As you know, there is Rasva Slokas. This is a slok in the Charak Sutra, Arthidas Mudani chapter. Tan Mahatamta Mahamulas Tas Ojha Parirakshita. As you know, it is a site of the Oj. So, Ojha Parirakshita means you have to preserve the Oj, you have to take care of the Oj. Paryaharya Vishishena Manasah Dukhet. Now, you can see, as you know, today's lifestyle, though diet and all, but the patient who are impatient, aggressive, ambitious, means who are sympathetically dominant, have more tendency to develop these sort of diseases, especially when I'm talking about stroke or cardiovascular, CAD or ischemic heart disease. And stress plays a very important role. You know the pathology of the stress or how the diseases takes place. So, in any of the disease, we talk about sharir and man. If sharir is involved, the man will also involve. Is psychosomatic. If the psyche is involved, then somatic component will be followed. And if initially there will be any physical element, that can also land down to the psychological involvement. So stress plays a very important role. So pariharya vishishena manasa dukhetva, anything that is responsible for the manah dukh, that has to be pariharya. It should be prevented. It should be eliminated. So here, many of our therapies or many of the yoga practices that are very vital to eliminate the stress of the patient. In Srimad Bhagavad Gita, we see Krodhat Bhoti Sammoham Sammohat Smriti Vipramam Smriti Viprama Buddhir Nasha Pranashati. If you see the pathology of the stress, Krodhat Bhoti Sammoham, initially, if there is growth, then the person will moh you. You see, he cannot take proper decision. Krodhat bhavati sammoham sammohat smriti vibramam. Smriti is anubhavjanya. Once you have experience, then only you can practice. Suppose you are gone for something and you know that that memory is with you, and in the next time you will not repeat that particular. That is smriti. Krodhat bhavati sammoham smritat sammohat smriti vibramam. Smriti vibrama buddhir nasha. Buddhi is your analytical means, which basically analyze and then gives you command what to do. When there will be buddhi nasha, buddhir nasha pradashati. This is the beautiful pathology of the Vishad in the Arjun Vishad Yoga Bhagwan Shri Krishna has mentioned, and it is very beautifully explained. So, any of the factor that is responsible for the stress, that should be eliminated. Hridam yat syad ojasyam sutasam yat prasadana. Hridya, anything which is hridya, which is good for heart, which is cardiotonic, like you know about the hridya dashemani. There are so many annapan or things has been mentioned which are said to be hridya. Amlaras is said to be hridya, which is good for you. That is hridya. So these sort of drug, diet, and dietetics should be incorporated. Ojas means, as I already is which increase the ojas status of the ojas, and srotasam yat prasadam. As you know, there will be the srotas are afflicted, and ultimately because of this the disease is there. So these srotas should be cleansified. Tat sevyam pratnen prashamo jnanamevacha. ये जो जितने भी all the things that has been mentioned has to be promoted, has to be incorporated in the treatment. And prashamo jnanamevacha means to know about the exact situation of the disease along with that thing. Gyan means knowledge. Knowledge means, I think I say it as in patient compliance and patient compliance along with the knowledge of the disease. So as mentioned earlier, these are basically the replica of that. Ujo Parirakshan, preservation of doses, Pariharya Visheshana Manasatukritva, elimination of the stress, Hridayrog, Hridayrog are the cardiotonic drugs, and Srotam Yat Prasadanam, cleansing the channels, and there are plenty of the medication that are available which can be used in this particular situation. Now, along with the Samanya Samprapti, that has, if you see the Samanya Samprapti, always when we are treating a disease, we follow the principles of the Samanya Samprapti, but the presentation of the disease, suppose it has a Vata predominant condition or Pitta predominant condition, accordingly, we, along with the Samanya Chikitsa, we incorporate the vitiated dose, and ultimately we plan the treatment. Telam sasorvikam mastum takram vate prapeyam lavranam shubhushnam Mutramu siddham lavadash telam anahagum arti hridayarnav. Now you can see in a Vata Hridayrog, when the manifestation are you analyze the manifestation and then after you label this is in Vata Hridayrog, then basically you can see there is use of lavan, also the use of the oils. Mutramu siddham lavadash. Basically, you can see many of the things that you know in the counter word we avoid salt, but here the anuloman karma that has been taken care, and as I said in the Davrat. So in Vatic situation, but these lavans should not be given alone. They should be processed, and along with any sort of the tal or something, it has to be given to the patient. In Pathik Hridayrog, Shita Pradeha Parisechanani Tatha Viroko Hridi Pitta Dushte Draksha Sita Chaudram Parushakis Shaz Buddheta Pittam Pitta Paham Annapana Draksha, Draksha. Sit means Mishri, Chaudra, Dugd, Parushak. These are basically has to be given in Pathik. While in Kapha Hridayrog, Simnasya Vantasya Vilingatasya Kriya Kaphagni Kaph Marmaroge, Kolarthe Dhanyascha, Daserva Annam Panani Tikshnati Sankaran. Means, as you know, Kapham Arivachi, whenever there will be involvement of Kaph, the medicine that are used, that should be in Ushna, Tikshna, and these sort of drugs should be given to the patient. But as we are treating with the Hridayrog, according the medicines that has been basically indicated in that particular situation should be used. Sannipati Hridayrog, Tridoshe Langanam Aditam Syadaneta Sarve Sudhitam Videyam Inati Matum Viksham Chev Karyam Tranam Karma Shastam, the dosha, saying the chance of the doshes, you have to plan the treatment. In Krimix Hridayrog, Prayo Anilo Ruddhagati Prakupya Amashayo Shodhanamev Tasmat Karyam
केला असं मी तिला फोन ती म्हणली हो ठरलंय ना आता तुम्ही या ना 12:30 पर्यंत.
Here, important thing is that there will be Shodhan of Amashay first, and followed by the Lanthan and Pachan, depending upon the Chikitsa form dose that you see. Now, as I said this, I just want to add one more thing. The condition of Vatic, Pathik, Kapha, Sannipata, and Tridosha Hridayrog, as per my view, these are the stated stages of the various conditions or the stages of ischemic heart disease. If I am talking about the Vatic, Pathik, and Kapha Hridayrog, these are nothing but the stages of angina pectoris, while Tridosha Hridayrog is a situation that can be more similar to the condition of non-ST MI or unstable angina. While the third situation, like Krimix Hridayrog, Tridosha Hridayrog Duratma Nisheve, as you know, many of the cases which are diagnosed with non-ST elevated MI or unstable angina have more chances to develop myocardial infarction in a duration of 1 or 2 years if you not follow the proper diet and dietetics. That also being mentioned in Ayurved. So doshe to hridroge duratma nisheje til gud chira deni. These sort of things, which are basically santarpan, which are rangan, which increases the, which increase arm. So, and marma ek deshi sankledak. There will be clay in a particular area of heart. Though many of the scholars of Ayurveda take it as bacterial endocarditis, but seeing the and it has been mentioned, Twaritam Jai means it has to be treated promptly, otherwise the patient will die. So seeing these particular situation, I will humbly submission that Vatic, Petic and Kapha Hridrog as a stated of the angina pectoris and followed by the condition of the Tridosha Hridrog and stable angina of non-ST elevated MI and the condition of the premature Hridrog is more similar with the condition of the acute myocardial infarction, as it has been mentioned, it has to be taken prime concern while treating this particular situation, and there is formation of the clay in a particular area of Marma Ekadesi Sankletam. That's why this scenario is more. Now coming to the management, as I said, the primary management, Srotasamya Prasadanam, Pariharya Visheshya, that has to be given. But if you are if you are in an area where you are not having particular medical facilities and you have certain medication, then you can try these medication like Prahatva, Chintamani, Pakatvaj and Himkar Potigas in acute situation. Though I am not claiming, again I am humbly submitting, if a patient is having siege of situation and you have the facilities to refer the patient, kindly attend the patient, give the primary intervention and then refer the patient by stabilizing the patient, because the time period is very crucial. If you have have the facilities nearby, you have higher center nearby, then any case which are being diagnosed as acute myocardial infarction should be referred accordingly by giving the primary management to the patient. And ultimately, if this situation is not with you and you don't have any other option, these are the medications that you can prescribe to the patient, which can basically help out and give you a time frame to refer the patient. But while we are treating the cases of old MI, and basically in our day-to-day practices, we have plenty of the cases which are coming to us, and ultimately, if we diagnose, then we refer to the cardiologist for the proper management. Along with that, you can add on some add-on management should be there, because patient life is quite important, and ultimately you are dealing with the life, so it has to be very responsible job. So if a patient is coming to you and if you have doubt and you have diagnosed the patient, if the patient has in severe situation, then you have to send to the cardiologist. Along with the conventional treatment that has been given to the patient, you can add on certain medication which are very good, like Arjunarish, Prabhakar Vati, Nagarjuna, Yakuti, Rasayan, Pushkar Brahmi. Lots of work has been done in Pushkar Mool, and Pushkar Mool is an excellent bronchodilator. It is Ushna and Shrotoshodak also. Not only it is bronchodilator, it is coronary dilator also. So Pushkar Mool is an excellent drug that has to be used. Now, talking about Arjunarish, Prabhakar Vati and Nagarjuna, if I am talking about the differential use of this, Nagarjuna is an excellent drug to improve the contractility of the heart and improve the circulation. But along with that, you have to give other medication with this particular drug. Basically, now if I am talking about Prabhakar Vati, though it is used in coronary artery disease, but many of the condition of where there is conduction defect, Nagarjuna or Prabhakar Vati is one of the good drugs. Pushkar Brahmi Guru, as you know, it is the drug developed in Varanasi University, and it is an excellent drug which serves all the front treatment principle of the Hridayrog. Like Pushkar is Shrotoshodak, Brahmi, Pariharya Visheshya and Guglu is Shrotoshodak. All the components are there. And along with that, the diet that has to be given to the patient should be Hrid. One important thing also I want to address at this point, if you read about the Rasayan, then you have seen in the Rasayan there is a chapter in which many of the disease that has been lifestyle diseases is categorically mentioned in Ayurveda. That is Sarve Sharira Dosa Bhavanti, Gramya Ahar, Amla Lavan, Shushk Mas Ityadi, that we are taking Paryushit and all. And the manifestation also mentioned कि Chitali Bhavanti Mansani, Vimuchyate, Sandhya, lots of the manifestation that has been categorically mentioned, and that should also be kept in mind while treating these sort of the lifestyle diseases. Now, one important thing that I also, because preventive cardiology is one of the greater aspect, because whenever we are treating any of the disease, we know first the condition you have to prevent, and then comes the management part. So as there is lots of the lifestyle diseases are there, the role of the Rasayan is very important. You all know about the Rasayan. These are the drugs which improves the dhatu status and ultimately improves the ojas status of the body. So these are certain Rasayan that can be used in cardiac disorders like Arjun, Shilaji, Ashwagandha, Sharparni. And Sharparni is basically mentioned in the Vatik Hridrog, and I found it very excellent drug to be used. I will talk about it because I am using Sharparni quite a lot in my day-to-day practice. Now, preventive measures, adopting an ideal lifestyle, as you know, Samyak Vyam, Samyak Ahar, Samyak Nidra, Ashtavid Visheshayatan, Viruddha Ashan, and these sort of things that have been mentioned in Ayurveda. It is full of the ethics and code of conduct that has been mentioned in Ayurveda. Intake of wholesome diet, use of Rasayan as per the Prakriti and Vikriti of the patient. Every patient will not receive same sort of the Rasayan. You have to identify. Following the ideals of the Achar Rasayan, you know, Achar Rasayan is good for your mental health. So, Satyavadinam, Akrodam, Nivritam, Matimatana, you know about it. So, these are the ethics or code of conduct that has to be taken care by the patient. Regular pubic exercises and medication and avoidance of the risk factor. As in the previous lecture, you have heard about smoking, tobacco, and alcohol, and other things. And also, I will add on the use of the many of the food items with preservatives and all, pistan. So these has to be avoided, and adopting an ideal lifestyle, ideal diet, ideal daily incorporation of yoga, because it not only gives you a good physical composure, but also you feel very stress-free while using the yogic practices. Now, I will talk about ischemic heart disease. One important aspect I also want to talk, and that is Vatik Sho. Chalas tanu parusho aruno asit prasukti harsharpito animittataha prashamiti unnati prapilito divavali chashatu samita. Why I am talking about this particular symptom? As you know, if I am talking about Hridrog, I have said the majority of the coronary artery disease or ischemic heart disease can be incorporated in Hridrog. But if I am talking about Vatik Sho, this is more similar to the condition of congestive cardiac failure. So if you are treating any case of congestive cardiac failure, Divavali means there will be edema in the dependent parts. Basically, you see on that part. While if I am talking about the left ventricular failure, then the condition of the tamak swans that can be asino labke sokhyamushne means orthopnea sort of manifestation has been mentioned there. So treatment of these conditions, if I am talking about the CHF, if I am talking about the, especially in pulmonary edema, that will be more similar to the condition of tamak swans, while Vatik Sho is more similar to the right ventricular failure predominantly or congestive cardiac failure. So in that scenario, Vatik should be kept in mind, and accordingly you have to treat the patient. Now, what is happening? Again, there is Sotosam, but there is Ekadeshiya Vritti and Anyatar. Means you can see the patient is having palpitation, tachycardia, restlessness, and all sort of manifestation like dyspnea. These are signifying there is basically in the Hridaya Pradesh, there is Chai, and there is Vritti in the dependent part or in the feet, or there is edema. So Ekadeshi Vriddhi Anyatar Chha, and this can be attributed because there is sun. Why is here Sira Prapya Kapha Pitta Asrak? These are the doors which basically Vibhaddha mark Vayu. Vayu, they afflict the normal circulation of the Vayu, and ultimately because usse the lingam shavtho purati, means there will be usse or there will be swelling, and that swelling is because of the affliction or the because of the obstruction of the by with the cuff and rug of Vayu, and ultimately that will produce those usse there. That's why Patik should be taken as congestive cardiac failure predominantly, and we are treating on that line. So what we have to do? We have to remove the Shroturod, and in that, if it is Urdhva, then they have talked about woman. If it is Adho, then they have talked about Virechan. If I am talking about Virechan, not only Mala Virechan, I am talking about the Mutra Virechan also, because in Ayurveda, the Mutra Katta Vibhajan is in the Unduk Pradesh, and ultimately, if you see the Sarkatta Vibhajan, you must know about the normal physiology that is taking place in terms of the Ayurvedic principles. That's why the importance of the region and Mutra Recha Kosha is very important in Vatiksha. So what we are doing, as you know, there is law Ekadeshya Chai, and if you see in the dependent part, there is Vriddhi. So you have to give strength to the heart, means any drug that gives bulk or strength to the heart, means so these are certain cardiotonic drugs that we use, and ultimately, if I say Hridayarnav is the drug of choice to be used in congestive cardiac failure, why I'm saying so? Because it is basically processed in Macoisvirus, and it contains tamra. So tamra is lekhan, shodoshodak, tikshna, and ultimately it remove the sangha, and ultimately it is a very excellent drug to be used. Punarnavashtak, not only it decreases the pre and after load, it has a very excellent quality of diuresis. So Shodhagna property is there. That's why Punarnavashtak, Hridayarnavras, Tivrit Chun for the Mala Virechan, and this is Sukha Virechan drug. We are not giving excessive or Ati Tikshna Virechan so that the Vayu cannot be vitiated. And Vardhaman Gudadrak Piyog, it is very excellent. But if the patient is diabetic, then you can shift to the other drugs. Ideally, these are the drugs. Along with these drugs, there are plenty of other medications that you can use, like Yavaksha, like Shwet Purpati, depending on the situation of the patient. So you have to give bulk to the Hriday. Then only you can use Hridayarnavras. It is very good drug. Along with Punarnava, it is Mutra and Shotoshodak and Shotagna property. That's why in the condition of congestive cardiac failure, these type of the medication should be used accordingly as per the requirement of the patient. Now, role of the rasayan, you know, one that can impart good nutrition at cellular level, by which one can achieve good health by virtue of prashasta dhatu, and equilibrium of dhatus is termed as arokya. You know about this, and labho bio sastanam rasadinam rasayanam. That's why rasayan drug should be incorporated in each and every prescription. As you know, in any Ayurvedic setup, if you are treating any sort of the patient, either it is in a patient of cardiovascular system, or patient is diabetic, or having hypothyroidism, or any sort of thing, appropriate use of rasayan, means the nematic rasayan should be incorporated in your prescription, so that you not only treating the disease, but also giving a good status of the dhatus. That's why the use of the appropriate rasayan is very important and very vital while treating the patient of any sort of the disease that has been encountered by. Now, these are attribute of the rasayan. You all know about Dirgham Ayuspati Medha Arogyam Prabha Swarvarnam Swarodharyam. Now, role of rasayan in preventive cardiology. As you know, we are also running a course in yoga preventive cardiology in our institution. So it plays a very important and vital role of use of rasayan, not only for the prevention, but also for the management. There is a study conducted in All India Institute of Medical Sciences about ashwagandha, which is an adaptogenic, and also it is a cardioprotective role. You can see that study. So use of many of the rasayan, use of shilajatu and other rasayanas is very important, and in the day-to-day practices, the patient who are hypertensive, the patient who have history of the coronary artery diseases, these identified patients should be given appropriate rasayan so that they cannot land down into the any sequelae. So these has to be incorporated, especially if I'm talking about the preventive cardiology. Along with that, if a healthy person has to maintain a good health, there is a good role of rasayan. So not only in physical but as also in the psychological, and rasayan not only improve the metabolism of the body but also relieves stress. So rasayan improves cardiac circulation, thus maintain the proper flow of blood to the myocardial tissue. By eliminating the stress, it decreases the cardiac load by parasympathetic dominance. Achar rasayan, ethical code of conduct, I have talked about it. It is basically again for a good mental composure. Now I will talk about some of the clinical situations that we encountered in day-to-day practices. Now, many of the patients with these situations comes with the complaint of palpitation. Sometimes it is basically because of any stress or cold. Sometimes it might be because of the anemia. Sometimes it is because of any of the cardiac pathology. So in this scenario, these two drugs are excellent, like Jaharmura Pishti and Ashugandha. You know, Jaharmura Pishti or this is a very Hridayabalya Aushadhi, and Ashugandha is a Vata Shama. If there is palpitation, especially if I'm talking about, then either it is because of the chalatva of vayu or by the ushna of the pit, ushnata of the pit. So these two components, basically, one situation palpitation is there, but many other situations like Rasachai, you will find palpitations, especially if I have talked about in short also. So in that scenario, you have to give proper like Shalaparaniya sort of medication are good for that. In conduction defect, Prabhakar Bhatti is very excellent to be used, and it is very effective in conduction defect. In Hridayrog, many of the patients who are having any cardiomyopathies or valvular heart diseases, or might be they are treated or not treated. Many of the patients of chronic rheumatoid arthritis, sarcoidosis, they have very decreased left ventricular ejection fractions, or they have alveolar dysfunctions. In this, Yakuti Rasayan and Shalparni Churn is very good. Especially if I'm talking about Shalparni in a form of Sheerbak, because Sheer, you know, it is Darpan Rasayan, and if we are treating with the Rasvas sources, and if I am talking about the Ras Prenam Karma that has been basically categorically mentioned, that has to be to counter that. Shalparni is one of the. One more thing I want to add on this. You are treating many of the patient of the hypertension, though I am not saying any patient who having mild to moderate hypertension or the patient who is already on the anti-hypertensive drug should be treated accordingly with the clinical manifestation. Now, giving just an example, and I will sum up with, I will end my lecture here. You have many of the patients of hypertension coming to the OPDs. Some of the patients are coming with the, as you know, hypertension is not mentioned in Ayurveda. We treat is an M.B.B.S.M.D because it is an condition with symptomology. So Ayurveda basically talks about the Lakshana, and ultimately you have to identify the doshas, seeing the manifestation of the disease. Suppose a person with hypertension is coming to you, is a lean and thin patient with fluctuating hypertension, having headache, having tremors, or having vibration sort of manifestation. It is in a Vata predominant condition. For a patient who is having hypertension, but the manifestation that is showing it is Vata predominant. Now, Ashugandha, Tagar are the ideal drug to be used in that particular scenario. The second patient, who is a young patient who is working in a BPOs or any software company, is very ambitious, is very aggressive. There is lots of stress in his life. Is not having proper sleep. It is very agitated. It is with the predominant condition. Now, the Mukta, Jaharmura, these sort of the medicines are good for him. So, as per the taratam of the disease or the manifestation of the disease, you can select your medication. Similarly, a patient is coming who is obese, who is hypertensive, but the blood pressure is somewhat in the moderate level 2 hypertension, and patient is obese. Now, this is the patient in which Sarganda is one of the important drugs to be used along with Bhallatag. But depend on the situation, depend on the clinical manifestation, you identify the status of the dosha, and accordingly you have to select the medication. That is my advice to you, because not in each and every patient you have to prescribe Nagarjuna or Dana or all. Seeing the manifestation, seeing other things of the patient, then only you can plan your treatment. I will sum up here. Thank you very much for patient hearing. If you have any sort of query, then I will be happy to respond to your queries. Thank you.
Thank you, sir. Your lecture was really beneficial. It will be really useful for the students as well as practitioners in their respective practice. Thank you for enlightenment on such a vast subject. Now I request all the participants and delegates that if they have any doubts, please ask. You can also write it down in the chat box. If anyone has any doubts, please ask.
I have a question. What is the role of Jaharmura Pishti or Vati in palpitation? I already explained. I have already said that if you see the seat of the dosh in the heart or in the hridaya, then there is a adhisthana of the sadhak with there. So whenever there will be palpitation, I have already stated that the two doshas are primarily the culprits. One is Vayu because of Chalatva Guna, and the second one is Pitta because of it is Ushna and Tikshna. So Jaharmura is basically when there is a Pitta predominant condition, that only in this scenario it is ideal drug to be used. Ashwagandha is there just to encounter the Vati component of that. If the patient is having these manifestations along with other features of the pitta like palpitation along with burning and all with headache, then you can advise Jaharmura Pishti in that particular situation. That depends on the manifestation of the condition. And ideally, I am saying many of the cases with palpitation of any pathology, if I am talking about it is because of Rasachai and all, it is an excellent drug to be used. But mind you, one important thing, the dosage is very important. Sometimes what happens, patient is having severe symptoms and you are just prescribing 250 milligram of the Jaharmura Pishti. So loading dose according to patient is very important. That's why in Ayurved, in general, if I'm talking about the charak, is not mentioning particular doses of particular drug. Either he has given some range. So that depends upon the Agni, Prakriti, Adhishtan, and all sort of the things that you are witnessing in the patient. Accordingly, you have to give the drug. Suppose a patient is having constipation, he is not having good appetite. Then you are prescribing ashwagandha, or ashwagandha in a dose of 6 grams. He will not digest that ashwagandha. Then your the desired effect that you are expecting from ashwagandha in that patient will not be there. So it is important, and according to the drug selection or the doses of drug should be. And one more question, I think from Dr. Shailja, please suggest drug for increased heart rate, which will be around 110 to 120 always. Ma'am, I have seen some of the cases like this, and some of the patients who are having idiopathic condition. Yesterday, I have seen a patient who is having now he has been asked for the money. Now, in this scenario, again in Vata Hridrog Shalparni has been mentioned, and it's very good drug to be used in this situation where there will be tachycardia. Shalparni in Trimarmi Adhyay mentioned in Vata Hridrog Chikitsa. One more question is, sir, hypertension is curable by Ayurvedic approach? Again, I am saying as you know, the hypertension, if it is not treated in the right time, and suppose the patient is having an elevated hypertension for a prolonged period, it will land down to end organ damage. So that should also be ethically think of. Though into mild to moderate hypertension, Ayurvedic therapies should be given. Along with, if a patient is taking any sort of the antihypertensive, some of the Ayurvedic Rasayan medications that should, like Ashwagandha, like Shalparni, like Arjun, should be incorporated into prescription, because they prevent the complications, they delay the complications of the diseases. But for honestly speaking, if you are saying in my clinical practice, if a patient is hypertensive and he is having blood pressure in this moderate to severe, I will not advise just to add-on therapy is good, but solely depending upon the Ayurvedic medication, I don't think that is wise.
So there are few questions from YouTube section. First is by Dr. Mubin Sayyed. In Hriday Basti, which drug useful for treatment of Hridrog Chikitsa except Urugvadi Tail?
Madhuyasti Cheer or Madhuyasti Tail is also good. I am honestly speaking, I am not given so much of Hriday Basti, honestly speaking. But in condition, sometimes we just go with a simple Pasarani or Balalakshadi, depending on the situation of the patient. But as I don't have much of the experience which oil or which krit is very excellent in particular situation, so I will not claim anything regarding that. But depending on the things, you can select any of oil or patient.
Okay, so there's one more question by Narendra Rajput sir. What is the best treatment of angina pectoris in Ayurveda?
I might say Pushkar Mool is one of the drug that has to be used. It is excellent drug. Pushkar Brahmi or Pushkar Mool is a very good drug. Nagarjuna is one of the good drug that improves the cardiac circulation also. Shilajatwadi Law, it is very good drug which is improve the circulation that can be used. Basically Nagarjuna, Shilajatwadi Law, and alongside you can use Shalparni and Pushkar Mool. These sort of medication can be used.
So there's question from Abhiranjan Kumar sir. If a patient of triple vessel disease with diabetes is having Udgar Bahulya and Shushka Kas, how to treat?
Anuloman is one of the important thing. I think I forgot to mention. Duratra Hingwadi Shul that has been mentioned in Trimarmi Adhyay in Udavrat Prakran, that should be given to the patient. But again, the patient is diabetic. We will say patient is diabetic, his triple vessel disease, go for an angiography, see the status of the vessel, because diabetes has, majority of the time diabetes has painless infarcts. So you can add on something, but I also advise patient to go for the right intervention. That is very important, because in my view, patient life is very important and we are here to serve the patient. So it should be not only treating each and every patient, but giving a good advice of giving or referring the patient in the right time is very important, because I have seen many of the patients in my in terms of my practices, we are diabetic and having coronary artery disease. They succumb without any warning symptoms, painless infarct. So we have to care for.
This question from Basanti Bisht. Any specific Ayurved investigation for heart disease?
No, I don't think so. Because if you are talking about the investigation, मैंने आपको पहले भी शायद I have mentioned that if you are talking about we are talking about Trisutra Ayurved and the manifestation of the disease. One are the Samanya symptom, these are the common manifestation of the Hridrog. Along with that, they have categorically mentioned Vatik, Patik, Kafaj and other manifestation in other variants. So by seeing that particular variant, seeing which Srotas is involved. Any of the disease, if you are identifying the disease, you have to see which dosh is there, the chance of the dosh, and that is not a rocket science. By seeing the patient, you can understand. Suppose a patient coming with the dyspnea or breathlessness, he may have breathlessness along with severe breathlessness, pain in chest, dry coughing. Now there is a predominance of vata. The second patient is coming with the prolonged sputum, with fever, with anxiety, with syncope. It is in pitta predominant condition. While third one is coming with there is heaviness in the chest along with lots of mucus secretions. It is kapha predominant condition. Accordingly, you have to judge. As far as the investigation are concerned, if a patient, you think it is doubtful case of coronary artery disease or IIC, you go for the cardiac marker, troponins and all with ECGs, and just identify the things, because sometimes in cases you may have a person with normal ECG, then go for the further investigation. That depends the investigation that we are having there. But as far as the Ayurvedic in diagnosis is concerned, that solely depends on the various parameters that have been mentioned in our text.
There's one more question from Vaidya Janil Naik from Gujarat. That, sir, I treated more than 300 patients of hypertension by diagnosed Varsha and found good result. Just need to know that is there any correlation found in a Shastra about this?
Actually, as you know, it is an Anukta Vyadhi, and Anukta Vyadhi Siddhant is there. I have already mentioned, because it is a miserable diagnosis. Basically, you have a spectrum and then only measure, and ultimately you found the patient is hypertension. But as far as I have already said, patient with fluctuating hypertension, having headache and tachycardia, dominant condition in which ashwagandha, bala, tagar, and other medication are. Otherwise, the second patient who is having palpitation, anxiety, and along with lots of anger and all those sort of things. With the predominant Mukta Prabal and other things are there that has to be used. In cup predominant conditions, Sarpagandha, Lashun Cheer, these things are used, and I think as per the manifestation, as per the situation, as per the manifestation, you have to treat the patient accordingly.
There's last question, sir, by Dr. Rajeshri. Can you please elaborate use of Shaliparni in Hridrog?
Actually, Shaliparni, I'd say I use in Hridayrog with solely or with the combination of Arjun, depend on the situation of the patient, in the form of Chirpak. Sometimes like this, and if a patient is having alveolar systolic dysfunction, and so I add on Nagarjuna with the Shaliparni. So that depends on that, but the patient who is having vata predominant situation, in that scenario, Shaliparni is one of the good medication. You can see the reference in Trimarmiyat.
Thank you, sir. Thank you so much for clearing our doubts. Now, moving further, now we are going to start a second session, and for that, I request Dr. Varsha Khot, ma'am, to introduce our guest speaker, Dr. Jai Prakash Singh, sir. Over to you, ma'am.
Thank you, Sneha. Good afternoon, all of you. I welcome all of you once again on this occasion of National Webinar on the Hridrog Chikitsa, Hridayanand 2022, on the behalf of Hon.Shri. Annasaheb Dange, Ayurved Medical College, Ashta, Maharashtra. Now, we are going to start the second session of the today's webinar on the topic of recent advances in cardiovascular ailments. Resource person of this session is a well-known personality of Ayurveda field, that is Dr. Jai Prakash Singh, sir. He is working as a professor and HOD of Department of Panchakarma, Faculty of Ayurved, IMS, Banaras Hindu University, Varanasi. Sir is a completed BMS with a first rank gold medal in 2003. He is a completed MD and PhD in Kayachikitsa from BHU Varanasi. He's also completed certificate courses in yoga and Sanskrit. Sir is having administrative experience as a proctor BHU Varanasi. He is a member of Academic Council BHU, member of Board of Studies University of Lucknow. Dr. Singh sir is member of National Academy of Panchakarma and the Research, member of Association of Ayurvedic Physicians of India. Sir is working as a research assistant for clinical trials. He is assistant editor of International Journal of Multidisciplinary Researches and also member of editorial board of International Ayurvedic Medical Journal. Sir has published 76 research papers in various national and international journals and 36 papers presented in a seminar. He is invited as a speaker in many events. Dr.Jai Prakash Singh has written 4 books on the topic of Ayurveda, which are published by Chaukhamba Vishwabharati Varanasi. Sir is awarded with Dabar Medha Award by Dabar India Limited, Saraswat Award by Akhil Bharatiya Saraswat Parishad. Such an eminent person in Ayurved field is the speaker of this session. I request to all the participants, please wait some while as the sir is joining very soon. Sorry for inconvenience, there is a technical problem. Please wait for some while. I request all the participants till sir will join here. I want to announce the result of poster presentation which were conducted and on the occasion of this webinar, that is National Webinar on the Hridrog Chikitsa, Hridayarnav 2022. The poster presentation were arranged for UG students, PG students and the PhD students all over India. And I am happy to announce that there are more than 60 posters take participants in this poster presentation competition. The rules and regulations of these presentation competitions were already declared in the brochure of this webinar. According to that, judges were selected ranks of the participants in this webinar poster competition. Now I declare the ranks of the 3 categories, that is undergraduate BMS students, postgraduate BMS students, and the PhD students from all over India. Now I announce the result of the UG section, that is undergraduate BMS student. The ranks are here. The first prize goes to Priyanka Ghongde, Honorable Shri Annasaheb Dange Medical College, Ashta, final year BMS student, and the topic is mental stress in hypertension and Ayurved approach. Second prize goes to Nikita Jadhav. She is also a final year student of ADMC Ashta, and the topic is hypertrophic cardiomyopathy. Third prize goes to Sachin Paratkar and Pratik Yadav, and the topic is Hridrog Chikitsa in Hridrog. Congratulations to all the rankers of the UG section. Now I declare the ranks of the PG students, and the first prize goes to, in the PG section, to Dr. Prajakta Janabandhu. She is from Tirak Ayurved Mahavidyalaya, Pune, from the Sanhita department, and the topic is Rudya Mahakashaya. Second prize goes to two students, Dr. Sneha Takle, ADMC Ashta, from the Department of Kayachikitsa, and the topic is role of Mrugashrunga Bhasma in Rudashul. And also the second prize goes to Dr. Atharva Khade, ADMC Ashta, Department of Kayachikitsa, and the topic is review of Hridrog in relation to Vatarakta. Now the third prize of the PG section. Third prize goes to Dr. Snehal Bhamkar. She is from Shri Ayurved College, Nagpur, from the Department of Swasthavritta. And the topic is assessment of preventive and curative role of Anahata Chakra meditation in a Hridrog. And third prize also goes to Dr. Tejasri Suryavanshi, LRP Ayurved Medical College, Islampur. And the topic is diabetes and heart disease risk. Congratulations to all postgraduate students. Now the result of PhD students. First prize goes to Dr. Rajashekhar Senapati. He is an associate professor of Panchakarma from Kanganwadi, Belgaum, and the topic is treatment protocol for IHD, Hridrog. Congratulations, sir. Second prize goes to the poster. Topic Yoga for Heart Disease and Prevention, and authors are Dr. Priyadarshani Hanje, PhD scholar of LRP Islampur and the assistant professor of Shalyatantra Department, ADMC Ashta, and also Dr. Swapnil Patil, associate professor of Vasantdada Patil Ayurved College, Sangli. Third prize goes to Dr. Sonal Shah Madam. She is from Dr. D.Y. Patil Ayurved College, Pimpri, Pune, and the topic is cardiovascular heart diseases. Congratulations to all the rankers of this poster presentation. Once again, on the behalf of Hon.Shri Annasaheb Dange Ayurved Medical College, Ashta, I want to congratulate all the rankers and all the participants which have taken part in this poster presentation. The certificates of this ranking will be provided in next 7 working days to respective mails. And also participants also get the certificates on their respective mails within a short period. So once again, congratulations to all the rankers, and thank you to judges also. I think there is some problem, technical problem in contacting with our resource person, Dr. Singh sir. Sorry for convenience and I apologize for that on behalf of Department of Kayachikitsa and also ADMC Ashta.
Now I request coordinator of this organizing committee, Dr. Rupali Patil ma'am, Assistant Professor Kayachikitsa Department, ADMC Ashta, to introduce Dr. Meenal Vaidya ma'am, who joined as an observer of Maharashtra University of Health Science. Over to you, ma'am.
Thank you, Sneha. Good afternoon, all. Myself, Dr. Rupali Patil, Assistant Professor from Department of Kayachikitsa. I would like to introduce today's our MUHS University Observer, Dr. Meenal Vaidya Madam. She has completed her MD in Kayachikitsa subject from Mumbai University. She is currently working as a HOD and Professor, Department of Kayachikitsa, Yerla Medical College, Kharghar. She has published 29 research papers in national and international seminars. I request Dr. Meenal Vaidya Madam kindly give her valuable remark about this webinar, Hridayarnav 2022. Thank you, Madam.
Thank you, Rupali. Myself, Dr. Meenal Vaidya, HOD and Professor, Kayachikitsa Department, Dr. G.D. Paul Foundation, YMT Ayurvedic Medical College, Kharghar, Navi Mumbai. Am I audible? Hello?
Sorry, ma'am.
Am I audible?
Yes,
hello?
ma'am.
Hello?
Yes, ma'am, you are audible.
Yes. This is a webinar regarding Hridrog Chikitsa, national webinar on Hridrog Chikitsa conducted by Honorable Annasaheb Dange, Ayurvedic Medical College, Ashta. It was very informative, though one session was because of some technical problems, Dr. Jai Singh could not continue or rather his representation was not there, but we got two representation, especially from Dr. Paranjape sir from allopathic department and Dr. Harish Bhakuni sir from Ayurvedic department, and both representations were quite informative. There were a lot of inquiries from Bhakuni sir also, and I think both sessions were quite informative, knowledgeable, and well said by Dr. Harish that yes, in Ayurveda, for as far as Hridrog is concerned, we are having many more limitations, and in acute stages we don't have a perfect line of treatment, which is not stated even in Brihad Samhita or in treatise, but still we can in mild to moderate cases, yes, we can treat, and with as a adjuvant treatment we can have many patients for even for hypertension, even for cardiac disease, coronary artery diseases, or even CCF. A lot of PG students are also coming with many projects on Hridrog Chikitsa. My PG student in last year had conducted, specially because this topic was not actually informed in this session. So I would especially like to inform that Dr. Sanyogita Shinde conducted specially on ejection fraction, role of Baladi growth on ejection fraction, and it was quite good, rather promising results. We conducted only on 30 patients, and as far as modern criteria are concerned, see, only 2%, only 5%, and only 10% is respectively considered as a mild, moderate, and excellent changes as far as ejection fraction is increased. So, and it was achieved only in a single patient, 10% raise in ejection fraction. For the rest of the cases, it was 5 to 7%, but within 3 months, even on going for only for oral application of Baladikrut, it was achieved. So that is a very promising result. So means conduction of such type of webinars, especially on the Hridrog, because this is I think a very untouched area of Ayurveda. Rather, we do go for adjunct therapies. We are not handling these cases with single Ayurvedic therapy, but yes, introduction of Panchakarma therapies in such cases may be giving quite good results. And as far as I myself have not tried with Hridrog Basti, but yes, with plain anal Basti, yeah, acted very good, promising results in Hridrog also. With this, I will sum up this session, rather my presentation. It was very good, informative and knowledgeable, but if it were possible for Dr. Jai Prakash Singh, that would be better for us. Okay, thank you.
Thank you, ma'am, for sharing your valuable experience. It's been a pleasure having you here, and now we are headed towards concluding part of this session. For that, I request Dr. Lokhande ma'am, Associate Professor ADMC Ashta, to convey vote of thanks. Over to you, ma'am.
Thank you, Sneha. So I am here for this concluding session. All we have listened these amazing and thought-provoking sessions by today's our chief guest and guest speaker. So I hope though cardiac disease is a vast subject and there was a time constraint, till today's dignitaries have done justice to the topic. So I take this opportunity to thank our founder chairman of SDSS, Honorable Shri.Annasaheb Dange ji, Appa. And then I would like to thank Secretary SDSS Honorable Advocate Rajendra ji Dange, Bhau. Then I would like to thank Executive Director Professor R.A. Kanai sir for giving constant support to us. I would like to thank today's chief guest, Professor Dr. Paranjape sir, as he remains as always backbone of our department and always guides us with his experience. Then I would like to give thanks to today's guest speakers, Dr.Harish Bhakuni sir and Dr. J.P. Singh. I would like to give thanks to Dr. Meenal Vaidya ma'am, who was today's university observer, and all MHS officials for giving us support to conduct this national event. Now I would like to thank our principal, Dr. Ashok Wali sir, who guides us to conduct this webinar. Now I would like to give thanks to all delegates who have participated from various states, because without your participation, this event would not happen. At last but not least, I extend my thanks to everyone who directly or indirectly made this national event successful. Again, I am thankful to my department and my all colleagues to conduct and support this webinar. One notice for all delegates and participants about feedback link. This feedback link will be sent to your respective WhatsApp groups after the end of this webinar. And you can also see feedback link into the description box of your YouTube link after 10 to 15 minutes after the end of this webinar. Now I declare this webinar is end. Thank you all participants and all dignitaries once again.